Good day everyone, I'm Lobaton from BSN 1A. For today's video, I will be doing on how to provide a supplemental oxygenation. The purpose of providing supplemental oxygenation is to deliver low to moderate levels of oxygen to relieve hypoxia. Assessment. Assess respiratory status like breath sounds, respiratory rate and depth, presence of sputum, and arterial blood gases if available. Assess past medical history, noting chronic obstructive pulmonary disease or COPD. For clients with COPD, hypoxemia is often the stimulus to breath because they chronically have high blood levels of carbon dioxide. If additional oxygen is needed, a low-flow system is essential to maintain slight hypoxemia so breathing is stimulated. And lastly, assess for clinical signs and symptoms of hypoxia, like anxiety, decreased level of consciousness, inability to concentrate, fatigue, dizziness, cardiac dysrhythmias, and dyspnea. Equipments: no smoking sign, oxygen source, flow meter and humidifier and distilled water. Procedure: review chart for physician's order for oxygen to ensure that it concludes method of delivery, flow rate, titration orders, and identify the client. It prevents potential errors. Wash your hands because hand washing reduces transmission of microorganisms. Good day, Miss. I'm Malakis Lobaton, your student nurse for today. You are Rio Eliza Elizario, right?
Yes.
Today, I'll be providing your supplemental oxygenation. This oxygen is your dyspnea or discomfort. Assess client to semi or high Fowler's position if tolerated. This position facilitates optimal lung expansion. Insert flow meter into wall outlet. Attach oxygen tubing to nozzle on flow meter. If using a high oxygen flow, humidifier. Attach oxygen tubing to humidifier. Oxygen in high concentration can be drying to the mucosa. Turn on the oxygen at a prescribed rate. Check that oxygen is flowing through tubing. Oxygen must be administered as prescribed. Hold nasal cannula in proper position with prongs curving downward. Place cannula prongs into nares. Wrap tubing over and behind the ears. Adjust plastic slide under chin until cannula fits snugly. Place gauze at ear beneath tubing as necessary. Proper placement in nares ensures accurate administration. Take note that the cannula permits some freedom of movement and does not interfere with the client's ability to eat or talk. If prongs dislodge from nares, replace promptly to ensure correct oxygen delivery and prevent hypoxemia. Assess for proper functioning of equipment and observe client initial response to therapy. Assessment of vital signs, oxygen saturation, color, breathing, pattern, and orientation helps the nurse evaluate effectiveness of therapy and detect clinical evidence of hypoxia. Monitor continuous therapy by accessing for pressure areas on the skin and nares every hours and rechecking flow rate every 4 to 8 hours. Permit early detection of skin breakdown or inadequate flow rate. Lastly, perform hand hygiene to deter the spread of microorganisms.